Hello everyone, it's Dr. Ryan coming to you from my office with another video review of one of the Step 1 free 120 questions. Today I'm going to take a look at Block 1, Question 34. I'll put a link to the question below this video, but on this slide I've summarized the key points. So this question describes a 52-year-old female who has 2 months of constipation and frequent urination. On exam, her lungs have bilateral crackles present. Her serum calcium is 11.1, which is increased. Her parathyroid hormone level is decreased. And a chest x-ray is done, and it shows hilar lymphadenopathy and interstitial infiltrates. And so based on this information, they want to know which of the following is the most likely cause of this patient's hypercalcemia. And they give us 5 answer choices, which I'll let you read to yourselves. Okay, so the easiest way to answer this question is to recognize that this woman has a pretty standard, typical, classic presentation of sarcoidosis. So how do I know that's her diagnosis? Well, first of all, she has hilar lymphadenopathy with interstitial infiltrates. These are classic chest x-ray findings in sarcoidosis. Hilar lymphadenopathy can occur by itself, but sometimes it occurs together with interstitial infiltrates. There are multiple different stages the lung disease of sarcoidosis goes through. Some of them include interstitial infiltrates, some of them don't. Because of the interstitial infiltrates, she has bilateral crackles. And then when patients have sarcoidosis, the macrophages can start activating vitamin D. They contain the enzyme that's normally found in the kidneys to activate vitamin D. This can lead to increased levels of calcitriol, the active form of vitamin D, and that can lead to hypercalcemia. So the fact that she has hypercalcemia is another clue to the notion that she has sarcoidosis. Her serum calcium is elevated. Her parathyroid hormone level is decreased. This tells you that she does not have hyperparathyroidism. Her parathyroid gland is responding normally by reducing the level of PTH, but that is not bringing down the calcium because she has macrophages in her lungs, which are overactivating vitamin D. And then lastly, the hypercalcemia is causing constipation, a classic feature of elevated calcium, and frequent urination. Patients with hypercalcemia often have a diuresis and they will report frequent urination. So everything in her presentation fits with sarcoidosis leading to hypercalcemia. And so if you scan the answer choices, the best answer is answer choice A, calcitriol, which is the active form of vitamin D produced by activated macrophages. As to the wrong answers, local resorption of bone by metastases is not correct. This is the mechanism of hypercalcemia caused by malignancy, but her presentation isn't consistent with a malignancy. Parathyroid hormone-related peptide secretion is another way that hypercalcemia can occur from malignancy. There are some malignancies, especially some lung cancers, that produce parathyroid hormone-related peptide. That can lead to hypercalcemia, but that's not what she has. Secretion of parathyroid hormone is incorrect. We just talked about how her parathyroid hormone level is low, so the parathyroid gland is responding appropriately to the hypercalcemia. And then lastly, secretion of thyroid stimulating hormone. This is incorrect. I think this question writer was just fishing for a 5th wrong answer and threw that in there. There's really nothing about her presentation that suggests a thyroid problem. And that concludes our video review of the Step 1 Free 120 Block 1 Question 34.